to monitor all those channels. So we'll keep an eye on your questions as they come in. I just had a little thing go up that said we are live. So in case you missed all my previous intro, really excited to have you join us for our 26th Senate District Town Hall, the first one of the session. I'm Senator Emily Randall. I represent the 26th from Bremerton, Port Orchard, Gig Harbor, and the Key Peninsula. This is my 5th year in the legislature, and we've done a lot of these virtual town halls over the last few years. And we're trying to make as many different ways for neighbors to connect with us as possible. So we have this virtual one today, and then we've got 4 in-person town halls next Saturday in Bremerton, Port Orchard, Gig Harbor, and the Key Peninsula. So just quick housekeeping run of show. I'll do an intro of my committees and my roles in the legislature, a little bit about this legislative session, and then we'll go to questions that folks have pre-submitted and the questions that you are asking on our social media channels right now. So you can drop questions in the comments below the Facebook live stream video. You can drop questions in Twitter. Let's see, there's a Twitter thing. If you quote tweet the video with your question, it'll be easier for my staff who's following along to find the answer. You can also email questions to me at emily.randall@leg.wa.gov. And I think we can ask staff to put that in the Facebook comments, and I'll do a little tweet that says, has the email address, so you can send those emails with the subject line virtual town hall questions. And if we don't get to your questions today, then we'll be sure to follow up by email. So before we dive in, recap of who I am and where we are in session. Emily Randall, state senator in the 26th district. This is my 5th session in Olympia. And I get to serve on a lot of really exciting committees for my whole term this is my 2nd term. Whole time in the legislature, I've served on the same committees, health and long-term care, transportation, and for the past 4 years, I have acted as chair of the Senate Higher Education and Workforce Development Committee. And it's a real joy to get to serve in those roles. I spent 2 years serving as Majority Caucus Whip, and now I serve as Deputy Majority Leader. Where we are in the session right now, we just passed day 61 of our 105-day session. 105-day is the long session. So for folks who don't follow the legislature, we have a long session and a short session in a biennium. So it's a 2-year budget cycle, 2-year policy cycle. 105 days in the odd number years and 60 days in the even number years. And during that time, there's a calendar of the different key points of session. Think about I'm just a bill on Capitol Hill, right? You introduce policy and it has until a certain time period to get out of the policy committee. And then it has a certain time period, another week, to get out of the fiscal or money committee, Ways and Means in the Senate. And then it has another 10 days till it has to be passed off the floor of the Senate and sent over to the House. And that's the deadline that we just passed. It's called House of Origin Cutoff. That was last Wednesday. And that means that all of the bills that have passed off of the Senate floor are still alive. There are some exceptions. They include bills that are necessary to implement the budget or impact state revenue. But those are exceptions and have to do with bills that generate money. So we wanted to have this town hall today at this time, right after cutoff, so that you can ask about the things that are still alive, the things that are moving. I know we do have some questions that relate to policies that didn't make it this year, but because this is a biennium, the first year of the 2-year biennium, that those bills will retain their place in the session timeline when we enter into next legislative session. So anything that happens in rule or anything that's in rules will stay in rules. All right, let's jump into questions. So let's see, we've got a question from Jerome. How are you working to increase healthcare access? Good question, Jerome. Expanding access to healthcare is one of the things that drove me to get involved in the legislature in the first place. I had a younger sister, who was born with really complex disabilities and medical issues. And it was because of Medicaid that Olivia was able to get the care that she needed. Even though, my dad had good shipyard employee insurance, it wouldn't have covered all of Olivia's needs. So the safety net made a big difference for me and my family, certainly in Olivia's life. And I know that Washington, has been a leader and can continue to lead in expanding access to care. So over the last few years, we've done a lot of things. I worked to pass implementing policy for the Universal Healthcare Work Group. We funded that my first year. Then we came back and created the Permanent Universal Healthcare Commission, which has been called the strongest universal healthcare policy to pass in any state in the country in the past 10 years, that empowers the commission and our state agencies to expand healthcare strategically without coming back to pass another bill, like the one that I passed to expand postpartum Medicaid. So that's kind of the system that we've set up, but we know we have to keep working faster and faster to make sure that folks have access to the healthcare that they need when they need it. One of the things that we're working on this year is passing a budget that includes funding for immigrants who don't currently qualify for Apple Health. We've got still, about 500,000 Washingtonians without access to health insurance. And we are working really hard to make sure that everyone in Washington can get access to the healthcare that they need when they need it. So that's a budget investment that we're working on this year. We'll keep working on it until it gets signed by the governor at the end of our 105-day session, and keep the pressure on to make sure that we're expanding that safety net. And the other thing that's important to know is when more people have health coverage, then it's less expensive for all of us, because we all pay into a system with our taxes and our premiums that are there to help folks who don't have access to care when they show up at the emergency room. And so we want to make sure that it's not just the emergency room where people are getting their care. They're able to get preventative, timely, high quality healthcare in their communities. There's a lot of other work around reproductive healthcare that we're working on, but I know we will have a question about that, so I'll leave the rest of it for that question, but know that we're focused on that too. Let's see. Alex asks what we're doing to address the nurse staffing shortages. I think this is really related, right, to access to healthcare, because if you don't have the medical staff in the medical facilities when you show up, whether it's the hospital or the ED or the doctor's office, you can't get an appointment, you struggle to get seen. And this is a workers' rights issue. We want to make sure that our nursing staff, our frontline healthcare providers who have been on the front lines throughout the pandemic, who are there in any emergency, have a safe place to work, just like any worker. Over the past year, I had a chance to be out in community having a lot of conversations with folks, including nurses. And I remember really distinctly one conversation that I had with a nurse in Port Orchard who, told me that we weren't aligned politically. She's a Republican, I'm a Democrat. And she didn't used to believe that we should take state action to regulate nurse staffing. But she also told me that she left her job at our local hospital because she was afraid that the conditions that she was working under would impact her ability to keep her nursing license. She was so worried about having to operate in conditions that weren't safe for patients and that didn't allow her to meet her standards and state standards of providing care that she left. I had another conversation with a nurse in Olala who was really struggling with the staffing levels at another hospital in Tacoma. And, she was doing it weighed so heavy on her heart, the work to provide care for her pediatric patients or her patients with significant behavioral health needs. And she and it has ended up leaving her job since then. So those stories, as well as the countless others I've heard from nurses in our communities and across our state, as well as patients, is why I was so excited to vote on our safe staffing, safe and healthy bill that impacts nurses, that makes a plan to ensure that each hospital has the nurse staffing that they need, that there's accountability, that we have a regulatory structure so that the meals and rest breaks requirements that we passed for nurses years ago are also able to be enforced, so that the frontline caregivers who are caring for us and our loved ones when we're in the hospital have the support that they need to do it safely. So we passed nurse staffing um, out of the Senate and onto the House. So we will keep watching that bill, keep working with colleagues in the House to make sure that it gets across the finish line. And for those of you who live in the 26th, probably most of you, I would encourage you to reach out to your representatives, Representative Caltier and Representative Hutchins, to make sure that they know how important nurse staffing is to you too. Let's see, from Heather. Is the legislature doing anything to address rising housing costs? Oh my goodness. This is definitely a big topic on everyone's mind. And it's one that has impacted me personally, that impacts all of our neighbors. I think I rented 15 apartments since graduating college. And so many times I moved out because the rent was just too high where we were living. I remember one of the last apartments that I lived in, we had like $1,000 a month rent increase. And I've heard from neighbors who are facing $200, $300, $400 a month rent increases. I'm also hearing from folks who, are struggling to buy their first home, or who have a home maybe that they bought a long time ago when the cost of living was much lower, or that they inherited from family members, and property taxes are pushing them into less affordability and making them worry about whether they can stay in their home. This is an issue that impacts everyone, from our neighbors who are unhoused, who are living in the woods or in the streets or in shelters, to folks whose assessed property value has skyrocketed in the last few years because of the cost of living around the region. We're doing a lot of things. And I want to first say, there's no silver bullet to solve our housing crisis. No one policy that's going to do it all. And that's why we have to do so many different things. But all of them are really important. Some of the things that we're doing are working on increasing supply, incentivizing ADU or mother-in-law unit incentives, or incentivizing the construction of ADUs. We're working on permitting so that it's faster and easier for our neighbors to get their ADU permitted. We're doing some work around multi-story buildings and the requirements for multi-story buildings. It was news to me this year that previous code requirements said that if you had a multi-story, multi-unit apartment complex, it had to have 2 internal stairwells. And I've lived in a lot of apartments in Boston, in Connecticut, in California, where it was like a triple-decker building, 3 apartments. They're common in lots of places around the country, and in other countries, certainly, that have, 1 main stairwell and then fire escapes. And so we are working on eliminating, complicated extra requirements that keep us from constructing lower cost housing. We're also doing some work around zoning and density, transit-oriented development that says that where there's already transit, frequent transit, not just one bus, twice a day, but on a fixed route stop, the bus comes much more regularly, next to light rail, as well. We want density. We want more housing where people can walk to the bus, where people can take transit to get to work, where it makes sense, not sprawl that impacts our environment, that makes more people have to drive farther, that makes us spend more money on new roads and new transit routes, right? We want to plan in a way that is smart. So working on transit oriented development and middle housing, which is coming over from the House. Has to do with local zoning requirements, and it's not. It's been kind of controversial in lots of parts of the state, including in Gig Harbor. But the version that's coming over from the House has some exemptions built in that I think will make it more palatable to some of our smaller city leaders. But, we're only halfway through the process, so there'll be a chance for more amendments. But I think a lot of things that will increase housing, as well as we had a bill to expand the property tax relief program for seniors who might be pushed out of it because of Social Security tax increase. And then there were some bills that died that had to do with rent stabilization that we'll have to keep coming back and working on. So lots in the housing space. Happy to answer more detailed questions if you want to follow up via email and ask about a specific bill. Let's see. It looks like most neighbors listed reproductive freedom as their top priority in our questionnaire. So let's maybe now is a good time to show what the questionnaire looked like. Yeah, so this is the survey that we sent out to folks who are registering for this town hall or our in-person town halls. And we asked folks to pick of, a list or fill in a other of the issues that matter most to them. So reproductive freedom was the top choice, healthcare access, the next healthy planet, I guess these aren't in order. So reproductive freedom, healthy planet, home for everyone. So housing, then we have student success, and then like a bunch of kind of tied answers. So let's talk about reproductive freedom. I think a lot of you know that I have been like a strong advocate for reproductive healthcare, reproductive freedom since I came to the legislature. Before I ran the first time, I worked at Planned Parenthood Federation of America, raising money to make sure that the Planned Parenthood affiliate healthcare centers in our communities were strong, that we were, we had legislators in place who cared about freedom, that we were doing the work that we needed to make sure that everyone had access to the rights and freedoms that were at that time enshrined in our Constitution, and that we, a lot of folks in my generation have taken for granted. I was born in the 80s and grew up in a time post-Roe when our rights were protected. And in the last decade, we have seen, and decades before, attack after attack after attack to try and erode our access to bodily autonomy, reproductive health care, and our freedom to plan our families when and how it's right for us. Over the past few years, we've done some work to expand access to care. Last session, I passed a bill to ensure that providers were protected in Washington State, that no individual who is seeking care could be arrested or detained or jailed. It hadn't happened much in Washington. We had one instance where, someone was sort of erroneously detained. So we wanted to clean up our laws there. We also expanded providers who could access. Yesterday was National Abortion Provider Appreciation Day. So I was thinking about this bill a lot yesterday. It's a bill that built on the state initiative that gave us access to abortion rights in Washington. And it put into law what was already an attorney general's opinion, that advanced practice clinicians, ARNPs and PAs, for whom it's within their scope of practice to provide care, we're able to do that safely and legally. And so we put that in place. And since then, we saw the Dobbs decision, and more of our neighbors were terrified about, you know, what the barriers would be to them getting the care that they needed, and what the barriers were for their friends who lived in Idaho or Texas or Florida. We're all in this together. And so we knew this year that we had to come back and work as hard as possible to make sure that anyone who lived in Washington or needed to come to Washington could get the care that they needed when they needed it. So to that end, we are working on a number of things. One bill that passed out of the Senate this year is about abortion cost sharing. In previous years, we've made insurance coverage requirements for insurance plans. I think there's one insurance plan in Washington that is religiously affiliated that doesn't cover abortion care, but we had already put into place sort of a coverage model so that if you opted into that plan and then needed to access abortion care, there would be care and coverage for you. But this year, our abortion cost sharing bill will ensure that folks don't have high out-of-pocket expenses, even with their insurance coverage. Copays can sometimes be a barrier. We want to make sure that everyone has real access to that healthcare when that healthcare is right for them. We also are expecting that we've got a few bills sent over from the House. One, an additional bill to protect providers who might be sanctioned in other states and to make sure that their license is protected in Washington and that they don't see, negative effects to, activist right-wing extremist behavior and lawsuits in Idaho or Texas or Florida or any other state where they might be at risk. We also have a bill, the SHIELD Act, sponsored by Representative Hansen in the House and Senator Trudeau in the Senate, that is puts protections in place for folks who come to Washington to access care, to make sure that that you aren't summoned and what do we call it, extradited to participate in a lawsuit in another state, that there are safeguards in place so that your information is protected and that we're not participating in any court cases, across our borders that are not in line with Washington's values and laws. We want to protect individuals who are coming to Washington state to seek abortion care from, any of the extremist activism in other states. And then, I've been doing some work on the Keep Our Care Act, which is around hospital and health system mergers and acquisitions. We in Kitsap County and on the peninsula don't have access to non-religious hospital. And practically what that means is a hospital or a health system that provides comprehensive reproductive, gender affirming, and end of life care. And so, while we didn't get the Keep Our Care Act off the Senate floor before the House of Origin cutoff, we do have it in rules so that when we come back next year, we can keep working on that. And additionally, in the budget, there is going to be some significant support for the clinics that are operating especially in those communities where hospital and health systems do not provide that care, but also, all across the state, we want to make sure that our clinics, who have seen a huge increase in particularly out-of-state patients since Dobbs and even leading up to Dobbs, have the tools and the support that they need to keep their doors open and keep providing essential healthcare. So that's a lot. Also, always happy to talk more about the work that we're doing to protect bodily autonomy and reproductive freedom here in Washington state. Let's see, from Robert, any updates on the rollout of Move Ahead Washington? So for folks who don't know, Move Ahead Washington was passed last legislative session, and it is what we call a transportation package. That's not the regular transportation budget. That is additional bill that has specific revenue to fund big projects, and including bonding so that we can pay for things over time in a way that we can't in the regular transportation operating budget. Transportation investments were important to me from day one when I decided to seek a seat in the legislature. For folks in our district, we know that we have specific transportation issues. Gorst is, not only a congestion bottleneck when folks are traveling into the shipyard or out of the shipyard for work or Keyport, but it's also uh, a real resiliency, a corridor that needs real resiliency work. The Puget Sound Naval Shipyard is the biggest employer in our region, and there's one way in and out, and it's through Gorst through the Sinclair Inlet, where we're seeing rising sea level, and we need to make sure that that roadway is resilient, not only for our community, for our workers, but also for national security. It's also, Gorst is a tricky place to travel through if you're not in your own car or in a worker driver bus. We don't have a lot of public transit that goes through. Mason Transit sends buses through Gorst to the ferry and to the shipyard. There's not pedestrian access. I was out walking around in some community sort of towards Belfair on the edge of Gorst, and it's precarious and dangerous to be a pedestrian there. It's also a place where I went on a bike ride with a group of our neighbors. Let's see, West Sound Cycling Club on the official Kitsap County bike map. And we rode our bikes through Gorst and caused a traffic slowdown while we were waiting to cross Highway 16, which is, legal. It's legal to cross the highway. That's the bike map. But so many cars slowed down that State Patrol came and pulled us over. And I think that's a real sign that we need not just infrastructure investments for today, right now, the folks who are using it now, but also for the future and the way that folks will continue to, walk, bike, roll, drive, take a bus. We need to be able to make sure that our infrastructure investments are forward looking. So that's why I was so proud to not only vote on Move Ahead Washington, but to be a part of the negotiating team in the Senate to get this across the finish line. It was a short session when we passed it, that 60-day session, the second session in a biennium. And we passed the package, but now we're coming back to do what's called project phasing. So that means in our budget this year, our transportation budget this year, we will spell out when certain projects will, the money that we have dedicated in Move Ahead Washington, when that money will be spent. There are some constraints, right? We can't spend it all at once. We don't have the ability, the workforce to spend it all at once. Washington State Department of Transportation doesn't have the infrastructure to do that. We also don't want all of our roads under construction at once. So while we have seen some of the Move Ahead Washington pieces already phase in, we've seen free transit access for kids 18 and under, buses, ferries, trains. We've also seen the toll decrease on the Tacoma Narrows Bridge, which was not in the Move Ahead bill, but it was part of the Move Ahead package that we passed. We have more to do in phasing in Gorst infrastructure, in ferry procurement. That means, how we're going to bid out new ferry construction, which we desperately need, and is funded in Move Ahead. We'll see, other projects all around the region be phased in a way that is appropriate and reflective of our needs. I've been very actively engaged with the chair of the Transportation Committee, Senator Leas, and our community members, the Gorst Coalition, Congressman Kilmer, business owners, and local electeds from county commissioners in Kitsap and Mason to, the mayor of Bremerton, to the mayor of Port Orchard, to, our port commissioners. Everyone is really focused on making sure that Gorst is phased appropriately. So hopefully we will have good news soon. It looks like the transportation budget will be rolled out right before the end of this month. So a couple more weeks to go. And then we will see the phasing in action. All right. John asks, what are you doing to support our police? Now, this is a question that I get a lot in the comments, on my Facebook page, tweets and emails. Appreciate you, John, for asking this question very respectfully. I don't, I mean, there is I think a misperception that Democrats or me specifically are anti-police, and that's not in my heart. I've got a cousin who's the first woman sheriff, the first Latina sheriff of Salt Lake County, Utah, and Salt Lake Unified Police. I've got first responders in my family, and I had the great privilege of going on a number of ride-alongs with local law enforcement over the past year to see on the front lines the things that are impacting their lives. I've gotten to go to their training. We did pass some police accountability measures over the last few years that not everyone is a fan of, but that were in response to outcries from our community to take those steps. Accountability doesn't mean not support. And so some of the things that we've been doing, additional things that we've been doing this year and in previous years to support law enforcement have been looking at investments. Washington State Patrol is having a real crisis hiring and retaining employees, particularly diverse employees, women, people of color, folks who are representative of the communities that they serve. And so we have focused a lot of money over the last couple of years to recruit and retain more State Patrol officers, which is the one law enforcement agency that the state directly funds. It's a lot of people think that the state budget directly funds local law enforcement agencies, and that's not correct. The city of Port Orchard police department is funded by the city of Port Orchard, and Kitsap County Sheriff is funded by the Kitsap County Commissioners and Kitsap County's budget. So most jurisdictions are funded locally, but we've also invested in competitive grant programs for local jurisdictions to apply for co-responders. So many of our law enforcement officers are being asked to do so much more than the work that they used to do. More behavioral health crisis intervention, more navigation of resources, folks who are unhoused, who need access to mental or behavioral health care, who need resources that might exist in the community, but they don't know how to access. And so some of the funding that the state has put aside was for co-responders, navigators, sometimes they're social workers, designated mental health providers, to work alongside law enforcement, sometimes like an actual ride along, sometimes it's one person in a department or agency, to show up alongside and to help de-escalate, to help our neighbors meet their needs. The most frequent calls are often folks who are in crisis for law enforcement, and there's not always a law that's being broken, or sometimes the law that's being broken is a symptom. So we're, trying to create more tools, more resources to help folks get the support that they need to live healthy, thriving lives and to keep everyone in our community safe. Additionally, we are looking at some policy around part-time, the authorization for part-time law enforcement officers. This came out of conversations with, around why we're struggling to hire women. And certainly all parents deserve access to part-time employment if that's what they need to keep their, families safe and to, take care of their families in the way they want. But we're hearing even louder from women who would like to work in law enforcement that a part-time schedule would allow them to do that, to meet their own family's needs, and also to be able to meet our workforce shortages. And so we're looking at authorization for part-time work, which is an exciting new development. We're also investing significant funds and creating a pathway for more training options. So for folks who don't know, the Criminal Justice Training Center in Burien is one of the is where people have to go to. It's like police academy, colloquially, and there you have to go there for a number of weeks to get trained to be a law enforcement officer. A lot of folks go there and then stay. And for people with families, for people who don't want to go and live and stay for weeks in at the Criminal Justice Training Center to get trained. More training facilities around the state, I think, will help in training and meeting our workforce needs. It's at the request of a lot of police chiefs and sheriffs who know that they need more options to fill their ranks, to fill those open positions. And so we're working on that too. So lots of stuff. I also, we passed a change to the high-speed chase policy in Washington off the Senate floor this week that changes the threshold from probable cause to reasonable suspicion, that authorizes some limited additional ways that police can engage in vehicle pursuits. We've heard a lot about this, and I voted yes on this change to the bill, but I'll say that I definitely feel complicated about more high-speed chases in our communities. But I also know that our law enforcement officers want the tools that they need to keep our communities safe. They want to make sure that folks who are breaking the law don't think they have the authority to break the law with impunity. And so I think that this bill is a good compromise balance to ensure that our law enforcement officers have the authority and that our communities are safe without dramatically increasing the number of high-speed chases that put bystanders' lives at risk and property at risk. So that's sent over to the House, and they'll keep working on it for the second half of the session. Additionally, I think housing, mental health, basic needs are investments that decrease crime. We see crime spikes when income inequality is higher. We see crime spikes when folks are having a harder time meeting their basic needs and keeping food on the table. We see property crime spikes when families are struggling, and so I think supporting our police and investing in basic needs are not mutually exclusive, right? They're very interconnected. So that's a long answer. Also, always happy to have a longer conversation. If you call or email our office and have other questions, happy to chat about those. What are we doing to help our seniors? Mary asks. That's a question that is important and weighing on my mind a lot. I think a lot of you know, but I am lucky to have two grandparents who are still alive and who live about 8 minutes away from me. They've lived in their house since 1967 when they bought it and are really committed to aging in place, like a lot of our neighbors. My grandpa will be 93 this year, so I feel very lucky. I also know that there are a lot of seniors who don't have family members and loved ones close by to pop in on them. There are a lot of seniors, on fixed incomes who are struggling to make their rent or their mortgage or their property taxes, who, are struggling to pay for the medication prescription costs that they have, who are struggling to get access to the healthcare that they need. So some of the things that we've done have been to expand access to telehealth so that not just seniors, but all of us who may have a harder time getting into the doctor's office can continue to have a lot of our healthcare needs met over the phone or, a FaceTime or Zoom visit. This is an important way to expand access to healthcare and to support seniors in the meantime. I had mentioned earlier my bill on property tax exemptions that will ensure that seniors who are just on the margin of getting kicked off of the property tax relief program, low-income disabled seniors property tax relief program, will have the chance to stay in that even when they get the nominal Social Security increase this year. So we don't want that raise to push people off of a tax relief program that is allowing them to meet their needs. So that's another thing. We also did some work to cap insulin costs. We have a lot of insulin dependent seniors. We're doing more work around prescription drug affordability. We have a prescription drug affordability board that's doing good work to create insight and give us more information about what we should do to lower prescription costs. We passed the Working Families Tax Credit, which will help a lot of Washingtonians, including, grandparents who are the caregivers for their grandchildren, which, there are a lot in our communities, to get a little bit of money back. We know that low-income families are paying a much higher percentage of their income in sales tax and in taxes more broadly. We have a regressive tax structure here in Washington, and that Working Families Tax Credit is putting money back in the pockets of families who are then able to use it. I heard from one family to buy new school clothes for, the school kids in their lives, that whether those are their own children or grandchildren, we want to make sure that people have the tools that they need. We've also done some work around PERS and TERS. That's a public employee and retired teachers pension programs and benefits coverages, to make sure that seniors on PERS and TERS, retired public employees, retired teachers have, are able to afford to meet their needs. So increases there. And so, certainly more work. I hear from seniors on a lot of different issues in our communities, especially around housing for their adult children with disabilities. And so we're doing some work around special community-based housing programs, investing in those. And I think that's something that I have heard multiple times when I've gone to an AARP meeting or retired public employees meeting, that folks care about the loved ones that they have been taking care of for a long time, and that they're worried that they won't be able to care for much longer. So lots of work there. And again, always happy to talk more. Let's see. Sherry McLaughlin asks, has our local hospital regained their accreditation? If not, what actions can we take as citizens? So I know that they're sort of in an accountability plan there. I don't have the most up-to-date information there in front of me, Sherry, but in our conversation about staffing earlier, I mentioned some of the stories that I heard from staff and nurses and patients who were really concerned about what was happening at the St. Michael's, particularly at the emergency department, but also at the hospital. We've heard from our local fire chiefs a lot of concern about what's happening there. So what the state is doing is working on the safe staffing plan. What I am committed to doing is also to continue to work hand in hand with our local elected officials and community members to hold our hospitals accountable, but also I know that at least the Kitsap County Commissioners and the Mayor in Bremerton and the City Council are really interested in increasing access alternatives here locally. There's been work happening to open the doors of a non-CHI Virginia Mason facility, and I think there's a lot of interest there. Save Secular Healthcare Washington has been also leading the charge across the state and in on the peninsula here. What we know is really important, in addition to sort of the accountability measures, is rates. This is, not something that we think a lot of as patients, about what the rate is that a hospital, health system, or provider is getting in reimbursement from our insurance, whether that's private insurance or Medicaid or state health insurance. But the Medicaid rates in Washington are particularly low as compared with other states. So that's something that I've worked on in the past, on reimbursement rates for providers and ensuring that we are increasing those Medicaid reimbursement rates to so that the health systems, our hospitals, our healthcare providers are getting paid for the work that they're doing and are able to keep their doors open, are able to staff at a healthy level. So both accountability and resources, the right resources to allow, our health systems to be healthier and to keep us all healthy. Let's see, Sarah. Hi, Sarah. What, if anything, is being done to address the shortage of healthcare support care workers, caregivers, medical assistants, etc.? Great question, right? It's not just nurses that keep us safe. It's and healthy. It's a wide variety of workforce that we need. We need, CNAs. We need medical assistants. We need phlebotomy techs. We need home care aides. Across the system, there is a lot of need. So, one bill that we passed off the Senate floor is sponsored by Senator Holy, who is my Republican ranking member on higher education and workforce development. And Senator Holy's been really focused on nursing care and a variety of licensures and certifications for nursing care. And the bill that we passed together requires some attention in local county workforce boards to understand where the needs are. And then it also has some investment in our community and technical colleges for, the programs that are going to meet those workforce needs. There are some other bills around medical assistants that are working their way through the legislative process. There are some other bills in support of removing the backlog for testing and training for home care providers and home care aides. And then I was meeting with SEIU 775, which is one of our caregiving unions, and a union that I was a former member of when I was a caregiver for my sister, just yesterday, day before, on Thursday, to talk about the budget needs. So, I talked about rates earlier, reimbursement rates, rates for caregiving, and bargained rates, which turn into salary for caregivers, is really important to making sure that we have a healthy system where, families who need caregiving support can find someone who can care for their loved one or themselves. And they need to be able to do that affordably. I've heard from a lot of caregivers who, are living on the margins themselves, who maybe they have also a loved one with a disability who needs a caregiver. Maybe they, are turned to caregiving because, they felt like it was a good way for them to use their skills, and who don't make enough to take care of themselves and their family, and who are considering either giving up entirely or limiting their hours and taking another part-time job. We need to make sure that caregiving, predominantly women's profession, is a profession that is also valued and in which there are benefits and a wage and career ladder that allow people to grow. So a lot more to come before the end of session, but thanks for asking, Sarah. I know that this is an issue that's important to a lot of our neighbors. Sarah Goldstein, are you planning to vote to pass substitute House Bill 1151? This is a bill that I was going to look it up, but that mandates fertility services. Yes, I think I was a co-sponsor on the Senate version of this bill. I think fertility coverage is related to reproductive freedom, right? We need to have the healthcare access to plan our families when and how it's right for us. So, we heard the Senate version in committee and it didn't pass out because we were expecting the House bill to come over. They've sent it our way, and I think next week is the hearing. in the Senate Healthcare Committee. I'm excited to vote yes on it out of committee. I'm excited to vote yes on it on the floor. I have joked to my colleagues that if we pass this, maybe someday I will become a parent. But I think what's important is ensuring that folks have the tools to make the reproductive choices that are right for them. And this is important. Let's see. Debbie asks, transportation, one of the largest barriers for people with disabilities is transportation. Are there any plans at your level to address this? Anyone living on the west side of Highway 16 can only be picked up 3 times during the day, and they must be driven to a location on the other side of Highway 16. Yes. Okay. Can we take this question off so that my face is not cut off? Thank you. Thanks for that question, Debbie. I hear from a lot of, I think, your students and from colleagues and from neighbors in our community who are having that same struggle. Whether you are, using Access, which is the disability transportation program, or whether you're using, another bus service, or, trying to get from point A to point B without a car. Travel in our community is difficult without a vehicle when you're relying on public transit. There's a group, Disability Rights Washington, that does a week without driving every year for legislators. And I've participated a couple of times. And I got to say, it's really hard to get from, my house in Bremerton to a meeting on the Key Peninsula or in Gig Harbor without a car. You got to rely on Uber or Lyft or a friend in a carpool to get a lot of places in our community. There's a bus that goes twice a day, from the Port Orchard Ferry Dock to the Purdy Park and Ride if you want to get intra-county. But what I can say is, in Move Ahead Washington, which we talked about earlier, we had some grants for local transit agencies. They had to meet a couple of requirements, including rolling out the fare-free travel for kids 18 and under, but they also got significant investments from the state into local transit. I know that Kitsap Transit is doing some bus service expansion. They're really interested in feedback from the community. I've seen a number of surveys come out. So I really ask everyone to provide feedback to your local elected officials who sit on the Kitsap Transit Board or the Pierce Transit Board, to let them know what you need. This question was specifically about Kitsap. I think Gig Harbor has similarly limited bus services. Key Peninsula has no Pierce Transit and has been really creative in coming together to use off-duty school buses, School Bus Connect, in partnership with the Mustard Seed Project. Our community is resilient and creative, but we need more transit. One of the things that I don't have a bill for this year, but I have been in conversation with neighbors about, is intra-county access or accessible transportation. Right now, you can't get inter-county access. So if you have access coverage, if you're disabled and qualify for access service, which I think Debbie was asking about, you can't get from one county to another. So I've talked to a lot of folks who couldn't get to Olympia to testify on a policy that they might want to, because they're reliant on access and they're in Kitsap County and would have to go through multiple counties to get there. Other folks in all across the state have that challenge. So I've been trying to figure out whether it's just federal barriers, whether there are state barriers, what we can do to incentivize some of that intra-county progress. So more to come. Happy to keep talking and working on this. I'll say we have 4 minutes left in our town hall. So this is going to be the last question that we will get to. Rick asks, I'm working with Congressman Kilmer to introduce a resolution in Congress to designate September 10th as National Suicide Prevention Day. Would it be possible to do something like that in the Washington State Legislature? Would you be willing to sign on as supporter of a congressional resolution. Thanks, Rick, for that question. And thank you for all of your incredible work around veteran suicide prevention. I've been really grateful to get to work with Rick to come to speak on Veteran Suicide Prevention Day on September 10th, multiple years. The resolution process, for folks who don't know what a resolution is, a resolution is, a proclamation, announcement, a letter. It looks like a bill that we introduce on the Senate floor and vote on it, and then send it to the governor to sign. We often do it to recognize particular days, and I will check with our staff about the calendar for resolutions, if we've got time to get one in before the end of this legislative session. If not, I'm happy to work on drafting with you over the interim and then make plans to introduce one next legislative session. So we will be in touch, Rick. And the same goes for anyone who is eager to have a resolution introduced for a special commemoration or a special celebration. I'd be happy to work with you in my office to draft and introduce. I think there's a certain number of resolutions that each member is allowed to introduce. Previously, I've done one for honoring women veterans, and I've done a motorcycle safety resolution. I think we also did one on the anniversary of the Americans with Disabilities Act. So, special celebration and commemoration of a person a month movement, we will be happy to work with you. So that's all the time we have for questions today. I want to thank you all for your really, really thoughtful work to ask good questions, to send them in advance, and to ask them live. I think this video will be up on our social media, on YouTube, on Facebook. We'll try to get it uploaded on Instagram too, so that you can go back and watch. And save the date for next Saturday. We have 4 town halls across the district. Saturday the 18th. In Bremerton, we're starting in the morning, 9 a.m. at Olympic College. Then we'll be in Port Orchard at South Kitsap High School in Theater 3, so not the big auditorium. At noon, then we'll be in Gig Harbor at the Swiftwater Elementary School at 2 o'clock, and then Key Peninsula at the Long Branch Improvement Club at 4:30. We staggered them because I know my seatmates, Representative Caldier and Hutchins, are in person today doing a number of town halls around the community, and we wanted to make sure that folks didn't feel like they had to choose between whose town halls to go to. So you have a chance to do 2 town hall weekends in a row. I am excited to see you at one of those locations, or in a virtual meeting, or in my office in Olympia, to keep talking about the issues that are most important to you. Thanks so much.